and sleep. The father of EEG, it was discovered by Mr. Hans Berger. Okay, it represents all overall activity of the brain. So they are basically summated potential. It is the sum of all the overall activity of the brain, and various waves can be seen. So suppose you are in meditation, your eyes are closed. So when eyes are closed, you are relaxed, you are inattentive. Okay, which wave will be there? Alpha. And what is the frequency of alpha wave? 8 to 13 hertz. And if you want to increase this low frequency alpha wave, you need hypothermia, you need hypoglycemia. So when we have hypothermia, when we have hypoglycemia, automatically low frequency alpha wave will be more in your brain and you will be relaxed. So hypothermia is good, I mean not that good. If you are in an air conditioned room, okay, you will be relaxed, and hypoglycemia will also. So alpha waves are prominent in which portion of the brain? Answer is parieto-occipital. And suppose your eyes are closed, you are relaxed, okay, alpha waves are there. Suddenly you open your eyes, alpha will block, beta wave will start. It is called as alpha block. So as you open your eyes, alpha will block, called as alpha block. Now you can see alpha rhythm, relax with the eye closed, you can see that amplitude and the frequency, you can compare with the beta waves. Beta wave, if you write beta, it becomes 13. So 13 to 30 hertz. Now amplitude is less, you can see, but frequency is high. Alpha was 8 to 13, this is 13 to 30. Eyes will be open, you will be attentive, and they are prominent in parieto-frontal region. Now theta waves, also called as memory waves. Frequency is 4 to 7 hertz. They are more common in children. In NREM stage 1, they are seen in hippocampus when short-term memory is converted into long-term memory. That is why they are called as theta waves. Now comes delta wave. Delta waves frequency is 4 hertz. They are more common either in deep sleep, NREM stage 3 and 4, deep coma, deep anesthesia, inorganic brain disease. They are very slow frequency wave. So deep sleep, D for deep, D for delta. Now the gamma, the maximum frequency during focused attention. Suppose you are solving some calculus problem, some numerical, and your brain is very focused. That time wave will be gamma. And they have maximum frequency. It can be 40, 50, 60. It can be in this range. And according to frequency, you can remember this by mnemonic: gamma, bat, dance. So gamma has highest frequency, 60 hertz. Beta has 13 to 30, like that. Alpha has 8 to 13. Theta has 4 to 7, and delta has less than 4 hertz frequency. So gamma, bat, dance. With the help of this, you can remember that from very focus to deep sleep. Very focus, less focus, eyes closed, NREM stage 1, NREM stage 3 and 4. So from very focus to least focus, you are in deep sleep, gamma, bat, dance. Now sleep. So we have 4 to 5 cycles of sleep, each of 90 to 110 minutes. Now there are two types of sleep: non-rapid eye movement and rapid eye movement. In one, you can say one cycle, usually it is 60 minutes, it is 15 to 20 minutes. NREM sleep always start with NREM. So first NREM will be there, then REM will be there, then NREM will be there, then REM will be there. So there is rapid cycling of NREM, REM, but as sleep continues, NREM keep on decreasing, REM keeps on increasing. These two points are very important. As we continue deeper in the sleep, NREM keep on decreasing, REM keeps on increasing. But during narcolepsy, during daytime sleepiness, what happened? Sleep start directly from REM. Sleep start directly from REM. So this is very important point. Now NREM, non-rapid eye movement sleep, they are the actual sleep. They are called as deep sleep, actual sleep, quiet sleep, orthodox sleep. And there are 4 stages of sleep. NREM 1, first you will close your eyes, alpha wave. Then you will go into sleep, theta waves. NREM stage 2, the longest wave, it is having very characteristic K complex. You can see biphasic K complex, and you can see sleep spindles. So K complex and sleep spindles are characteristic of NREM stage 2, you can see sleep complex, K complex is like this, sleep spindles are like this. So these two are very, very characteristic of this. Now stage 1 and 2 are called as, they are called as mainly light sleep, and NREM stage 3, stage 4, they are having delta. Delta should be written like that, delta. Delta waves are there. So delta waves appear for the first time in NREM stage 3. In stage 4, more than 50% are delta wave. And remember, gamma is for focus. Gamma is written like that, delta is written like this. Now, what are the changes in NREM? So when you are in NREM sleep, okay, you are relaxed. So body movement will be decreased. Temperature will be decreased. Blood pressure will be decreased. Heart rate will be decreased. So everything is coming down. You are relaxed. But the respiratory rate is decreased in both NREM as well as REM. So among all those, which is the only thing that decreases in both? Answer is respiratory center, because when we are sleeping, it suppresses respiratory center. So either we are in REM or NREM, your center of sleep will be, your respiration will be suppressed. Okay. Now REM sleep, rapid eye movement sleep, your brain is active, your body is like paralyzed. It is not paralyzed because tone of the muscles will be less. So don't use the word paralyzed, just remember their hypotonia. I am just using this word so you can remember. It should not be used that it is paralyzed. No, in REM we are not paralyzed. I have used this word, so please don't write this word in your exam, just say decrease in the tone. I have written this so that you can remember for your exam. It is like a mnemonic, that your body is like paralysis. So muscle tone is decreased, but your brain is active. So which wave will be there? Alpha and beta wave. So alpha wave and beta waves are just like that. When we are awake, we have beta waves. Close your eyes, alpha waves, but we are awake. But even in REM sleep, when we are sleeping, then too we are having alpha and beta like that. So it is a paradox that we are sleeping, but your brain is active. So it is called as paradoxical sleep. And the first muscle to get into atonia is neck muscle. That is why when you are traveling in a train or a flight, you will bounce like that. Neck muscles, cervical muscles are the first muscle to get paralyzed, not paralyzed, sorry, atonic. They will get atonic. Don't use the word paralyzed. I have given the example so that you can remember. In REM, we are like that. We cannot move your hand. Okay? Pseudo paralysis. You know sleep paralysis? Sometimes you wake up but you cannot move your hand. You will read it in your secretary also. Sometimes they ask in the viva. Why is that? Because in REM, body lost the tone. Okay, so you're sleeping as if there is a paralysis, but they are not paralysis. I'm highlighting this point. Paralysis is something else. We are saying sleep paralysis, but it is not paralysis. Because the tone is decreased, so you are saying sleep paralysis. Okay. Now BP will be more, heart rate will be more. So you are like, you are awake. In males, there can be penile erection. Sexual arousal can be in both male and female. It is called as paradoxical sleep, active sleep, and superficial sleep. Now, if you see EOG, eye movement, you can see only in REM sleep. Rest we have already discussed. Now, dreams can be seen in both REM and NREM, but both are different. In REM sleep, they are very long, they are visual, they are emotional, and they are not connected to the reality. So these dreams are, for example, in the dreams you can be a king. It is not connected to the reality and they are very visual. But in the NREM dream, they are short, less emotional, conceptual, and they are related to the reality.